I'm Dr. Emma Pola McLeod, a naturopathic doctor and CEO of NutriChem, here with Dr. Benny Hashimi, and it is so exciting for me to have a cardiologist here at NutriChem collaborating with us, working together on a topic that we are so passionate about, which is prevention and integrating healthcare. Having practitioners work together side by side, we are identifying major gaps in the system that are impeding people from getting care that is really, really critical to them. And so having someone like you who is stepping into an area like prevention with your background as a cardiologist is just so exciting. I am, really, really happy to be collaborating with you. And I think we could just kind of talk all day about any topic because, I'm so curious as to your thoughts on hormones and fish oil and supplements and diet. So thank you for collaborating with me. This has been so exciting.
Thank you, Emma. Yeah, this is a very exciting collaboration, and I think there's a lot that field of medicine can learn from naturopathic medicine with regards to the holistic care and prevention. But that's really what we're trying to do through our collaboration is to try and have a more holistic approach to patients and have a more preventive approach to patients. And there's lots of areas of very nice overlaps with regards to supplements, hormones, and how it affects the cardiovascular health. So we have much more exciting news and projects with regards to how we're going to collaborate on these different topics. But today specifically, we're going to focus talking about hormones specifically, particularly for perimenopausal women, and a little bit about fish oil and how it's beneficial for different population of the patients and evidence behind fish oils and hormones more particularly.
Today, we're here to talk about heart health in menopausal women. This is a topic that is super, super important. Women 50 years of age, postmenopausal, we see them all the time. They're not sleeping, they're exhausted, they're stressed and anxious, their bodies are changing, they might be gaining weight, maybe they have a family history of cardiac concerns, and they're looking for answers and they don't really know where to turn to for support.
Exactly. And usually what happens is because of all these body composition changes that happens during menopause, they develop cardiac risk factors. So their blood pressure starts to rise, they have issues with their cholesterol, and that's exactly what this collaboration becomes so important and relevant.
Yeah, because these are the women that need hormone therapy and hormone support the most. We know that estrogen loss is what's driving a lot of these body composition changes, yet they get flagged as high risk on a cardiac screen and they don't have access to the very therapeutic that could be the most beneficial to their heart.
Exactly. And that's the whole reason why we decided to start this collaboration, because these women are the ones who benefit from this therapy the most, but they're not getting it. So what we do is we bring them into this program, do a full cardiovascular risk screening on them to make sure that the therapy is going to be actually safe for them.
And this is true integrative medicine, right? It's looking at the preventative side for not only heart health through cardiology, but also looking at the hormone and preventative side to support all the lifestyle factors that we know are critical for heart health.
Absolutely. So I love these conversations that we have. Tell me about what you think about hormone therapy.
I'm a huge fan of hormone therapy. As you know, we work together with menopausal women. It's a really nuanced subject that I think on social media, there's no context when we talk about things like estrogen and progesterone. There's a huge benefit for women transitioning through perimenopause and menopause to understanding when to bring hormones in and how to use them appropriately. And they can be extraordinarily beneficial for things like sleep and energy and brain fog, but also, as you know, cardiac health and more prevention.
100% agree. I mean, as we both agree, not enough women are actually getting it, especially women who benefit from it the most are the higher risk women, but they're usually denied hormone therapy, particularly estrogen. All right, Dr. Emma, let's talk fish oil. Tell me a typical patient that you prescribe fish oil to.
So for anyone coming in for cardiovascular health, a lot of eye conditions, dry eye, dry skin, post-concussion, these are the most common patients that I prescribe for. How about you? Who are you prescribing for?
Typically, for me, are patients who have dyslipidemia, particularly if they have elevated high triglycerides, because we have pretty good evidence from randomized control trials that if your triglycerides are significantly elevated, we can reduce cardiovascular outcome with kind of high dose of EPA that we're going to talk about. Tell me a little bit about the composition of what type of fish oil you generally prescribe for your patients.
So if I'm doing it for cardiovascular health, we're definitely looking for a high EPA, especially because we know that's the one where the research is. If it's more for post-concussion cognitive function, then we actually want to look for a high DHA. Are there any patients that you wouldn't prescribe fish oil for?
So that's a great question. So there has been mixed signal about atrial fibrillation and possible increased incidence of atrial fibrillation on fish oil. So if somebody has particularly poorly controlled atrial fibrillation, that would be definitely a patient population that would be very cautious with regards to fish oil. Anything else you want to add about fish oil?
The only other time I'm cautious is when people are heading into surgery. If we have them on a really high dose of fish oil, we typically get them to stop a couple days before, because we know that's how it works. It's very anti-inflammatory. It thins the blood. So we just want to make sure we give patients that information. And what about you? Do you recommend a liquid or a capsule, or does it matter to you?
For me, the way I conceptualize that is ease of use. So I find the tablets are generally large and difficult to swallow. So definitely if a patient has swallowing difficulty, I usually give them the drop. And generally speaking, I find the drops are just easier to take for most patients, so the compliance go up. How about you?
Yeah, I agree. I find to get to the high doses above the gram into the 2 gram, it's so much easier to get that with a liquid. You can get it at 1 teaspoon, a teaspoon and a half, versus often that's upwards of 4 capsules in a day. So compliance is key when we're trying to change outcomes and prevention. So we want to make sure people can actually do what we're recommending.
I love it.
For more information on women's health, hormones, and heart health, visit nutrichem.com or come visit us today.
And follow our YouTube channel at Cardiac Longevity Clinic and our Instagram and Facebook channels, Cardiac Longevity Clinic.